Welcome back to Yes, She May. Today we interview Dr. Picone, who is a specialist in lungs in the Washington D.C. area. He also has been volunteering to help fight COVID in hospitals in New York City, so he knows firsthand this disease.
Dr. Picone, it's good to see you for the first time since March.
Great to see you.
And as I know, working with you as my doctor also for all these years, you're a specialist in lung disease. During the COVID-19, there are so many myths and questions about the use of face mask. Now I'm also wearing one that is made up of silk. So I would like to hear from the expert, what are your recommendations for the kind of mask people should select and for the different occasions?
Right. So as you know, unfortunately, we don't have a whole lot of research on the different types of masks. Of course, this is a type of N95 mask. There are other masks, the regular surgical masks, and then of course now, silk and all different types of fabric. I think the most important thing is consider what type of environment you're in. If you're in an enclosed environment, close to lots of people you don't know, you have to wear a mask, you have to wear the mask properly. And so it doesn't matter the material as much, as long as you keep a mask on, that may decrease the infectious dose. We know that N95 masks decrease the infectious dose by 95%. That's why we call them N95s. And so, but even if you just have a silk mask, that as long as it covers you well, then you are decreasing the amount of airflow and decreasing the infectious dose.
I see. And when you say wear the mask properly, can you share with us what are some of the wrong way of using even a good mask?
So this is a proper way. So a good seal, that means a good seal. In other words, there's a good seal all around.
Right.
There's a good seal down below, there's a good seal above, so you know that all the air that you're breathing in goes through the mask. Okay? So if there is flow that goes outside the mask, then the mask is not doing any filtering.
Right.
Now, it doesn't mean, in some environments it doesn't really matter.
Right.
If we are outdoors, it doesn't matter because you probably don't need to wear a mask anyway.
Right.
This is an infectious, organism, but it's not as infectious as people think.
Right.
And in fact, I had a number of my own patients who the spouse was infected and the other spouse living in the same house, sleeping in the same bed, and sharing the same household did not get infected. So, in other words, we got to keep in mind, it's common sense, is not, the precautions have to be rational. We don't have to be scared. It is an infectious organism, but for instance, it's almost impossible to get infected just by touching a surface that is contaminated. Because the infectious dose is mostly air and mostly somebody who has, as you know, now we know there are super spreaders, people who have a very high viral load that can disseminate very high counts of the virus. It's disproportionate how some individuals infect more people than others.
Speaking of a lot of viral count,
Yes.
is there a particular stage during which time a person has been affected or infected, the viral count is particularly high?
Right. Yeah, the funny thing is we know that the peak of viral shedding happens about 24 hours, within the 24 hours of peak symptoms. So preceding this, because the study has been done where people, in fact, healthy volunteers were infected and the viral count has been followed. And so we know that so if somebody becomes infected, let's imagine that you get exposed and we follow your particular viral shedding within the 24 hours or so before the peak of symptoms is when your viral shedding is highest.
I see.
And that continues for about 48 to 72 hours and then it starts to decline.
I see.
And so likely if somebody becomes infected, you are infectious for 7 to 10 days. Even we know that people can continue to shed the virus for up to 42 days.
Oh, wow.
If you look for the PCR, if you look for the segment, for the RNA segment of the virus, you can find the virus in the secretions, in the nasal secretions and so forth, up to 7 weeks, up to 6 and 7 weeks out. but it doesn't mean that it's infectious.
Got it, got it. So it's really that particular period of
Right.
time that are
7 to 10 days.
very dangerous. And that's probably why the quarantine has always been around 14 days.
Right.
It's a safe frame
10 to
of
14
time.
days is a
Right.
safe period to keep in mind.
I see. So many of us are traveling. I heard you just traveled yourself for some time off. We are actually going to drive to vacation on the beach. What happens when someone has to take a flight this summer and they have to fly to, some danger zones such as Texas, California, so to speak? Any particular advices during the summertime when there's vacations
Yes.
or for school, college students going back to school particularly?
Right. Yes, I have my own kids going back to college, and so I was actually flying to New York all through at the end of March, April, and May, and I think the planes have never been cleaner than they are now. Air in the planes is filtered and recirculated, but the air that is coming out of the vents is clean. You will not get infected from those vents. So as long as you keep a mask throughout the flight and that you're careful not to be fiddling with the mask, not to be playing with the mask and so forth, you should be fine.
You should be fine.
The particular concern is the area when you go to a bathroom, because bathroom has many contaminated surfaces, but in planes, air is recirculated very rapidly. So it's unlikely, so if you go to a bathroom, for instance, in the plane, you probably shouldn't remove the mask right away, or just keep your mask in the bathroom at all times. If you have to brush your teeth or you have to remove the mask, I would wait such that the air is refiltered before you remove your mask.
I see.
And then just common sense. If you have to fly, because you have good reasons to fly, I would do it.
Right.
In fact, I flew to New York 10 times, all through the peak of the epidemic, and I checked my serology, and I know that I was negative.
Right.
So I didn't get infected.
Right.
I mean, I was wearing protection, or just common sense protection.
But you were in the middle of fighting the disease with the doctors in the hospital there.
Right,
So
but
you were in the middle of all the viruses. But you were
Right,
able to
but
protect
I
yourself.
never got infected.
Right.
So that means, and I didn't use crazy protection. I just wear, truly, this is the mask that I was wearing all along. This is the type of mask that I would wear.
N95. So speaking of travel back to school for the college bound, what about for middle school, high school, and even children? There's a lot of debate about whether to open school or not. So for a parent trying to make a decision about whether to send their kids to school, what are some of the considerations they need to take into account?
Right. So I personally feel that this is a condition that has very low mortality and very low morbidity in people who are old, younger than 40 years of age, and particularly younger than 20. So I think it's time for people to get back to school and get back to work. So of course, I think that it's important to have some flexibility. For instance, if in a particular household there are family members that if they get exposed to the virus, they may have potentially a bad outcome. People who may be immunocompromised, who may have, pulmonary conditions that can make them more susceptible, or that can decrease their functional reserve, and may potentially, increase the likelihood of complications. That needs to be taken into account.
Right.
But I want to emphasize, just having a pulmonary condition doesn't mean that those patients will go on to die from COVID-19.
Right.
So, in fact, I have a pulmonary practice, and I had about 25 of my own patients become infected. Not a single one had respiratory failure or ICU support.
Wow, that is amazing.
Only one of them required hospitalization,
Right.
and he recovered at home just fine.
That is a good news. So
The point is, to answer specifically your question, I think it's time to get back to school.
right.
With precautions.
Right.
Of course, kids will potentially get infected. It doesn't mean that, for instance, when we have an epidemic of influenza, we don't close the schools.
Right.
Now that we have to learn to live with COVID-19
Right.
with precautions, but it doesn't mean that, of course, the main resistance I feel is from the teachers. Many teachers just don't want to themselves become exposed.
Right.
And we have to make some accommodations. If you have a teacher who is immunocompromised or has diabetes or has some other conditions, well, maybe they need to be protected.
They could do online teaching.
Exactly.
Right.
But so we need to certainly take into consideration individual situations.
Right.
But by and large, for most of society, I think it's time to get back to school, back to college, and back to work.
And get out of the house.
Exactly.
That is your recommendation. Well, it's been very informative, and good luck for the next 6 months, where obviously everyone is a little bit scared of what to come in the fall versus when it's spring going into summer. So we probably will come back and check in with you as we see the country going back to school, going back to work. But
Absolutely. Happy to share
We will be in
my
touch.
wisdom or lack thereof.
Yes.
And, have fun on your vacation. Just
Excellent.
use common sense precautions. Just
I
don't
will.
be crazy about, don't be
Yes.
paranoid.
don't be terrible.
But try to avoid the restaurants.
I know. Well, you have a good summer too.
Please give us a like and subscribe to our channel. And if you have any questions or comments for Dr. Picone, please leave a comment in the comments section below.